My name is Edward Camacho. I'm a chiropractor in Pennsylvania. I have been in sports medicine since 2007, to be exact. I started in an athletic training educational program in undergraduate, and I ended up going into chiropractic college down at Palmer in Florida campus. I pursued after that a sports chiropractic degree, and I really focused on the international aspect of having the opportunity to travel worldwide instead of just staying nationally. I spend a lot of time with athletes, whether it's on the sideline or within a clinical setting. As a chiropractor that also is a self-employed business owner, there is a lot of decisions that have to be made. There's a lot of lessons that we all learn. There are mistakes that we make. There's money that we spend and waste. In the journey of these last 11 years in professional practice and over the last 15 plus years of sports medicine experience, there's a lot of products I've tried, there's a lot of things I've done, there's a lot of mistakes I've made. And something that I've had the honor to do is work with a lot of high-level athletes, from IPF World Powerlifting Championships to high-level collegiate wrestlers, UFC fighters, professional soccer players, both men and women. I've been exposed to a lot of different avenues, as I'm sure a lot of you have as well. Something that really takes pride on is the lessons I've learned along this journey. What works, what does not work. What avenue or patients best work with me. What I enjoy doing and what I don't enjoy doing. All these things make me very easy to apply my experience and knowledge with you as well. I think from the situations that you deal with, I probably already have dealt with, are currently dealing with, or will deal with soon. How I found out about 2717 is through a professional fighter by the name of Bo Nickel. Bo communicated with me and informed me of a product that he has utilized in the past. I found interest because of his capacity and ability to perform at a very high level. If he's using it, I want to know more about it. He talked to me about this product, and specifically copper peptides. At first touch, I had no idea what he was talking about, nor did I have any background training or information on the extent of what a copper peptide could do on the body, in the body, etc. He gave me a bottle to try and utilize. First touch, it smelled great compared to a lot of other things that are out there. It also smelled different, which I kind of liked because my office did not smell like every other chiropractic office in town. The best part for me was seeing the outcomes when I got to use it on myself or other patients. I felt since Bo had an association with the company, there was going to be a bias there. There was going to be some sort of preferred preference in regards to his needs and his desires in regards to a product he works with and has on a regular basis. I wanted to go at it from a third-party perspective. I tried it out. I liked it. I used it on other people. They asked questions, and I didn't really tell them much except, I'm trying this new product. Let me know what you think. Some patients are going to be honest. Some people are going to have a placebo effect and just say, yeah, it's great. Other people are going to say, doc, it did nothing for me. I've heard all of the above. Because of this, I have information and data on what it works on and what it does not work on. And we'll talk about that here shortly. In my experience working with this product and with my patient base, a couple things that I've identified that this does not work on, and other things that I've identified this does work on, comes down to a simple expectation management. This is a topical cream. We're putting this on the skin to accomplish a desired outcome. Is this going to help a disc that is putting pressure on a nerve at a particular level in your neck or low back? No. I'm going to be very honest. This is not going to fix your nerve pain or your nerve complaint from a spinal column issue. What this will work on is the surrounding musculature around that region, around those joints, the muscles in spasm, the bruising, a chronic area of overuse and tightness where the muscle just needs some relief. Think of your desk jockeys, computer programmers, people who are just sitting there with their shoulders crunched up all day. This is a product that would work for those areas. However, a disc compression that's putting pain down the arm following a C6 nerve root pattern, that is not going to be resolved by topical application. Now, once again, areas of the body that are very, very thin, meaning the skin's close to the bone or joint, we're going to see a massive ability to influence the outcome of what we're trying to accomplish. Knees, ankles, feet, hands, knuckles, wrists, elbows, depending on the shoulder, maybe clavicle, collarbone, AC joint. Think of the tissue size in comparison to the joint we're trying to influence. Is this a muscle complaint or is this a labrum tear? A very different type of diagnosis, which may or may not positively respond to a topical cream. Is this cream going to fix a torn ligament, an ACL rupture, a labrum that's torn on the left side, a slap tear? Any of these types of complaints? No. The rotator cuff injury, the strain, the partial tear of a biceps tendon or long head biceps tendonitis. These are issues that will respond positively to a topical application. We always have to keep in mind the patient's size and area of application as well as the dosage. One little small amount versus a glob rubbed in over time. Small bodies, large bodies. Very thin areas to the joint, very deep areas to the joint. Always take an educated approach on how we're going to use a topical cream with a positive outcome to the cellular level of what we're trying to influence. This product can do almost everything except fix a bad mind and a negative mindset. Keep your mind open, try this in some areas, use it on yourself, use it on others, get honest feedback. We're all familiar with the placebo effect. Does this work because I want it to work, or is this actually working? Don't ask us, ask the patient. I always tell my patients, try before they buy. I use it clinically in the room. I put it on them first. I say, let me know how you feel or what you notice next appointment. Or here, take this home with you, use it for a couple days. When you come back, let's follow up. Always be smart in how you're approaching these decisions. I'm a business owner just like you. Money doesn't grow on trees. We want to find things that are profitable for our practice that gets the outcomes we're looking for. I'm definitely going to show you a couple of my favorite ways of how to utilize this product and get really good success with. All right, so what I'm going to do is I'm going to utilize a Graston technique, factor technique, however you want to use it, IATSM. I'm going to use an instrument to apply the cream as my emollient for the skin. I'm going to do this mostly on tissues that are tense, hypertonic, maybe even a very, very light spasm situation. I want to bring blood flow to the area, so I'm going to stimulate it utilizing a metal tool to scrape the surface itself, and then the cream will be my emollient. I'm going to use an ample amount, depending on the patient size, maybe about a nickel to a quarter size of cream over the area, gently massage it in, scrape. At the end of the therapy, I do not remove the excess. I just allow the excess to kind of be rubbed into the body part and let that sit for the day. So I have about a nickel size amount. I'm going to go over the levator trap muscle from the upper shoulder blade all the way to that posterior lateral neck. And I kind of outline my region or my zone with my application. I put the muscle on stretch and I move the instrumentation with a very, very, very light glide. I'm doing this until I see a nice color change or a pink hue to the skin. I don't want to drag or scrape aggressively. I always go and move the instrumentation into different directions, not just up, down, not just cross friction, but I also introduce cross friction diagonal patterns. I'll also move the head into different directions. I'll have the patient turn towards me. There you go. Shorten the muscle and lengthen the muscle. I'll even drop this arm behind the back, take a little bit of an accentuated stretch, and have the patient look away again. And as you can see here, we're getting a little bit of pink change right there in the lateral neck muscle, and that is going to be my cue to stop scraping in that particular zone. Once I'm done with that, I just massage in the excess, and we are done. This is what I call my secret weapon. mostly because this is what I did not expect to have a massive outcome with. However, the application of a heat source with the utilization of the cream gave me very quick results where the athlete started to notice quick changes much faster than I was expecting and much faster than they were expecting. So with this situation, I do not have a diathermy unit. However, I do use a red light therapy. So I'm going to put the cream over a thin area joint like a knee, ankle, wrist. In this perspective, I'm going to use the elbow. I'm going to put the cream on the elbow in a situation like a tennis elbow or golfer's elbow complaint. I'm going to put the cream, massage it in with an ample amount. I'm not going to rub it in. I'm going to literally cake it on, keep it thick. Then I will apply the red light source over the elbow, strap that down for about a 20-minute treatment. Once I'm done, the heat opens up the pores, allows a lot of the ingredients to be delivered through the pores, and then we get a really, really nice deep tissue change to the muscle complaint or musculoskeletal inflammation. I do this therapy as a passive modality. I set the patient up. While the patient is what I would call cooking on this therapy, I can go do and treat another patient, communicate or work on a different body part. When the time is done, all we have is a moderate amount of heat around the joint, a very light glisten of the product on the skin. I gently rub it in to make sure there's no noticeable excess, and then we complete the treatment. What I'm going to do with this situation is called a cup and drag technique. I'm going to use the 2717 cream as an emollient for the skin. I'm going to use a very light distraction or cupping device, and then we're going to drag the area of complaint along the muscle fiber direction to improve blood flow and circulation to that specific muscle tissue or tendon area. This is a really good way to not leave cupping marks on your patients. And then gently drag upward and downward. The cream is going to allow us to glide on the skin, and then when we remove the product, we don't get a really aggressive octopus presentation or cupping bruise because of the skin emollient being utilized. Also, at the end of this treatment, just rub it in and let the patient go on their way. So for this perspective, I'm going to do a soft tissue release and active release technique, any type of myofascial work. I like to use the cream as an emollient, but not too much where I'm sliding off the skin too fast, but I'm also getting a really good contact and then bringing the muscle through different planes of motion so I can get a really good reduction in muscle tension, spasm, adhesion releases, etc. For this technique, I use a very small amount, like a size of a rice, depending on the patient. I'd rather use less is more. We can always reapply or add more to the treatment, but if we start with too much, it's gonna be very, very hard to wipe it all clean and start from the scratch. So start with a little bit. I do a lot of soft tissue releases. Allow that skin to move underneath your finger. Bring the muscle through full planes of motion, rotation, triplanar movement, flexion, extension, rotation on the transverse plane, lateral abduction or adduction. Good. Some people will say your finger contact is giving them discomfort on dry skin. This is a nice little hack to get a benefit from the topical cream, but also to reduce the impact of your finger contact while doing myofascial work. And at the end, rub in a small amount of excess and you are done. In my experience, results for a typical patient, depending on the diagnosis, can be seen within the first 2 to 3 days. I've had one individual who said one application one day fixed her problem. Another individual with a very different diagnosis and body usage took about a week and a half for him to see outcomes that he was comfortable with. 2717 works best with a healthy diet, proper nutrition, and ample rest. We have to always remember the body works better when it is better. Applying a topical cream to an unhealthy environment is not going to change your life. Make sure you always educate people properly on what they need to do to set the environment of their body to respond the way you and me want things to go. 2717 is a supplement. It is an additional tool to your repertoire or whatever tools you have within your office. It is something that an athlete or a parent adds to their bag, to their healthy lifestyle, to their medicine supplement cabinet at home. It is not the end all be all. It helps in helping us get where we want to go and help others go where they need to go. GHK is a peptide sequence. A peptide sequence is a chain of amino acids. Now, lucky for us, GHK is naturally made in the body. What amino acids are in this chain? Glycine, histidine, and lysine. Those are the 3 things that make GHK. Now, when you apply that with a copper molecule, you get what's called a GHK copper peptide. And that is what we're dealing with. A copper peptide itself has been researched and shown to keep DNA healthy. It activates genes that repair your tissues. And it also helps with turning off the genes that are responsible for inflammation and tissue breakdown. GHK copper peptides are known as a signaling peptide, meaning they tell the body what to do in a particular area or zone. Some people even joke and call this the Wolverine peptide because of its ability to heal tissue, regenerate tissue, and have anti-aging properties. Arnica is a natural herb that has been around for many years in multiple civilizations because of its anti-inflammatory properties. These properties applied in a topical cream format can have very favorable effects when utilized for a lot of the musculoskeletal complaints we see on a daily basis. 2717 is CBD and THC free. It is a very clean label. 27 essential oils are in this label product and combined to add and be a supplemental force in generating the outcomes that you are looking for. Essential oils have been utilized for thousands of years, going back before the Bible, and being utilized for healthy responses, medical complaints, or even physical conditions all around the world. If you are a licensed professional and you're looking for something to help yourself in practice or even some of your customers in practice, it's my opinion that you should absolutely give this product a try. It's working for me. It has been working for months in my office for many different types of complaints of many different age ranges. I am very happy with the outcome. I'm very happy with the cleanliness of the label. I'm very happy to endorse and promote the product because I was using it before this opportunity came to be. If you have questions, I highly advise you to reach out to me or get in contact with me with whatever questions you may have that may be on a specific manner. I have been playing with this product in a bunch of different ways. I have seen it work in various avenues. I have seen it not produce the outcomes I was expecting in other avenues. If you have any concern, let me know. I think overall, as a provider, as a business owner, as a young person just trying to help other people in this world, I'm very happy with the product. I love using it myself, and I definitely recommend my patients or athletes utilizing it in their daily repertoire. It is not the only thing I do in my office. There's a ton of other opportunities for me to help a human, but 2717 is something I definitely can stand behind. I really appreciate your time. I know we're all very, very busy individuals. Time is of the essence. If you have any other questions, check out the content below, reach out to one of the people within the company, look at the website, read some reviews, find me personally to communicate. Iron sharpens iron. 2717.